U.S. Supreme Court is preparing to make its decision on President Obama's health care law. Well, the odds are they've made their decision. The decision is probably written, and they're probably just tweaking it right now, so they know what we don't know. A new study, though, is out today, and it raises new concerns about the unintended consequences of that law. The Doctor-Patient Medical Association found 83% of doctors say they're thinking of quitting medicine if this law is fully implemented. 90% say they feel America's medical system is on the wrong track. 70% believe the single best way to fix the situation is to reduce the size of government. Joining me now, Dr. Mark Siegel, who's a member of our Fox News Medical A-Team, and Stan Hupfeld is a former healthcare executive and author of Political Malpractice, How Politicians Made a Mess of Health Reform. Gentlemen, welcome to you both. Dr. Siegel, let me start with you. 83% say they may quit medicine if Obamacare remains in place. Come on.
Megan, I don't know, truthfully, whether they're going to be able to quit or not. Some are trapped. But when you're thinking about somebody taking care of you, taking your blood pressure or operating on you, you don't want this kind of survey of doctor discontent. Doctors are miserable. I do my own surveys every day. They're unhappy. They're seeing too many patients. Another thing in this survey...
But to quit medicine? To quit medicine altogether, though, after all the time and effort they put into it, and the ego getting associated with being a doctor, is this real or is this a threat just to express unhappiness with the law?
It is real, but it's not going to actually happen to this extent because doctors are trapped. They can't quit because of the reason you said. They're down the pike too far along with the specific training they have. They don't know how to do anything else. They don't know how to do anything else, but they're seeing too many patients in too short a time. Another thing in this survey, Megan, they said the doctor-patient relationship isn't what they want. You can't have a satisfying doctor-patient relationship in 6 minutes. Let's face it. And that's where offices are going these days.
Dr. Hupfeld, you are a hospital CEO and an expert in this field. You tell me, when you talk to doctors, do they like this law?
Well, of course, there is a great deal of anger and resentment and fear in the law, but I think Dr. Siegel is absolutely correct. The idea that 80% of physicians will quit medicine simply because of the law is, I think, of a bit of stretch. You know, the fact is that if you look at the survey itself, only 4% of the physicians surveyed responded, and of that 4%, more than 50% were practicing medicine more than 20 years. The only 8% practice medicine less than 10 years. So we're talking with an older group of physicians who are clearly used to medicine the way it was traditionally practiced, and the fear of the unknown adds to the fear that they have.
But the sample size is small, I guess, Dr. Siegel. I don't know, actually. It sounds like I don't know if it's abnormally small is what I'm trying to say. But does it tell us something about the feeling of our practicing physicians about this law?
Right, and I disagree with him on this point because there's been several other surveys out on this. Deloitte was one. There's one on the doctor's website. This is the way doctors are feeling, younger and older, because, again, the law is backloaded, not front-loaded. Let me explain what I mean by that. It's in favor of expanding coverage for people, but it's not looking at what doctors want, and doctors are pulling the cart that carries health care. We're not making enough money. Look, that may sound selfish, but if you want somebody to be happy, you pay them more. Instead, insurance is paying them less.
Let me jump in, and I'll let you finish that point. But I mean, we're talking about doctors. A lot of doctors, they pay for 4 years of college. They pay for 4 years of medical school. They have to go through residency, fellowship, internship. I mean, you could be more than 10 years of training, and then a lot of these doctors start at $100,000 a year. That's a nice salary, but not when you have 200 plus grand in loans and 10 years of earning $30,000 under your belt because you get paid nothing when you're a resident.
Great point, Megan. And when you're faced with increasing liabilities, increasing malpractice insurance, decreasing services, you want to sit there and order what you think the patient needs, but somebody turns it down now, more and more regulations, and you're liable, not the insurance company. So whether it's public or private insurance, and this survey said also physicians are very sick of Medicare and Medicaid right now. But I think it's across the board.
But Mr. Hupfeld, is this dissatisfaction among the doctors due to Obamacare? Or is it due to a continuing erosion in the way we practice medicine, the lawyers, the absence of malpractice reform, and so on?
I think even before the Affordable Care Act was passed, you'd get the same sort of response to a survey. Physicians historically have been concerned about the encroachment of insurance companies, malpractice, and other kinds of issues that the doctor points out. But to make the leap that huge numbers of physicians are going to quit medicine simply because of the act, I think is a bit of a stretch. If you look at the survey results, over 60% of physicians surveyed think that electronic medical records compromise medical care. Well, it's very clear that we have to move to a more automated record in order to control cost, and that much of the duplication we see is because of the lack of an automated record.
Dr. Siegel, I'll give you the last word.
We're talking to a very small slice of physicians.
Can you encapsulate, Dr. Siegel, in ways we can understand quickly? What is it about the health care law that's going to so change the way you practice medicine that you and others like you would consider this?
And I agree with Stan, Megan. We were already unhappy to begin with. And here's what's going to change. It's called piling on. You're at the bottom of a pile, and they're adding 30 million more people on top of it with the same kind of insurance that it's easy to overuse. Come on in whenever you want, even if you're not sick, except I don't have the time to take care of you. And with a growing doctor shortage, they should have looked at the fact that physicians are overwhelmed and we don't have enough.
You're going to have to work harder, see more patients for not a whole lot more money.
Where I would disagree is the fact that we were heading for this problem already. We had way too few doctors for the ballooning.
But there's a question about whether the health care law fixed that problem or made it worse. We're going to have to leave that question open for now, guys. Thank you both so much. We're continuing to